my good people, and in today's video we are learning about amoeba causes, transmission, symptoms, diagnosis, management, and even prevention. Most people know about amoeba, but the organism that causes this is called Amoeba histolytica. It's a protozoa, in fact an intestinal parasite that normally invade the intestine and cause more havoc. Basically it is transmitted via fecal oral route, and by doing this it's more popular in densely populated areas where there is poor sanitation, where people do not practice washing of their hands, where they just eat without taking care of their water, their food. And when you ingest the cyst of amoeba, it exists itself and develop what we call trophozoites, and this invade the mucosal layer of the small intestine and causing more problems like bloody diarrhea. And it can even complicate to cause what we call liver abscess. It can cause what we call cardiac infection, that infection of the heart, and it can even cause what we call brain abscess. It can affect your brain. So we take it very serious, because sometimes you might get a patient having a liver problem, but when you do investigation you get that this particular patient was just having amoebiasis, which has complicated. Most patients will present with loose stools, and which normally progresses to bloody diarrhea. Severe abdominal pain can be elicited, and even weight loss plus even fatigue. When amoeba invades the small intestine and burrows itself there, it can even cause lesions, and we call this amoeboma or amoeboma. So these lesions can complicate and prevent even absorption or even motility of stool in the intestine, and eventually a person may lose weight because of lack of nutrients. So as I said earlier, we take this particular organism very serious. How can we diagnose it? We normally take fresh stool for analysis, and you can even do what we call enzyme link immunoabsorbent assay to detect Amoeba histolytica, the so-called ELISA test. You can do polymerase chain reaction, you can do liver function test just to rule out the infection of the liver. Ultrasound and even CT scan is very important for us to decide whether there is lesions affecting the liver, or even the lesions affecting the intestine. Then we can do colonoscopy just to see the presence of the parasites in the colon. And when there is a perforation or even colon involvement or even peritonitis, CT scan can help us, even ultrasound can really help us. Management is very simple. We have what we call nitroimidazoles, that is metronidazole, the so-called flagyl, tinidazole, odinazole, and also we can add the loxanide furoate in terms of management. When there is perforation or peritonitis, we can even go ahead and do surgery. It's very important to do hand washing in terms of prevention, and also boil our water and keep our environment clean. Thank you so much for watching this video. If you feel that you need more of medical videos, kindly watch this one that appears somewhere here for more details on medical videos. Thank you so much, and let's meet in the new video.